Another rainy day here in New England. Was going to do a little video tutorial for you guys outside, but obviously because of the rain, I can't go outside. So we're going to be masked inside, do talk about something as a Q&A that had come up on some of the previous videos. I've been getting a lot of email questions from endodontic residents, dental students even, young people, and also obviously some of the older people about proper posture and proper positioning and what they do in order to maintain their kind of alignment and their body health during dentistry and endodontic therapy. Of course, dentistry puts a tremendous amount of pressure on our joints. Neck and upper back, lower back, elbows and shoulders are prime joints that are getting completely hammered during endodontic therapy and dentistry as a whole, and endodontic therapy specifically and especially because you're maintaining the static contraction in specific poses for extended periods of time. If you don't pay attention to your posture, which is the very important part, you're going to have a short career. Now, what I have learned over the years is that you need to constantly be aware of your posture and the way you are treating your patients in order to be able to get the longer career for yourself. And this is especially true about you younger viewers and dentists and endodontists. And so I figured I'll just make a quick little video informally to share with you some of the things that I do between patients and maybe a little bit of positioning. If you want to get more detailed into it, you can write below, comment below, and I can probably get into other videos where I can talk a little more detail about each one of these concepts. All right, so let's take a quick look here at the way I position myself sitting. I obviously use these self-contained carts that are awesome because it allows you to only have one rheostat and then be able to work. If you're doing endodontics, you're going to be using a scope, and the scope is an important component here. And the biggest problem I see when people are using the scope in terms of positioning, they end up going up high, tilting their neck and going into these all kinds of weird positions. Then they have to maintain this position for too long, and that creates a lot of tension on your back and in your neck. Your goal here is to be, and it's also just to give you a quick tip, try to use these surgical chairs so that you can end up having proper posture and also elbow rest. The goal here is to make sure that you are sitting, with your pelvis slightly tilted forward, and you have a straight spine that goes all the way from your coccyx all the way up to your atlas vertebrae here. You want to be nice and straight. The most important part is the neck. Another big mistake that happens during endodontic therapy with the scope is people tend to do this or they have scopes that have a very short objectives, and they tend to do this and their neck goes forward and they're basically doing this. This is tremendous amount of tension here on your neck, and it all translates into all kinds of problems down the line with arthritis in your neck and other kinds of muscle issues with your deep cervical muscles as well as your trapezius. And that's part of the reason why you get so tired in your trapezius at the end of the day. So make sure that all you're trying to do here is that you have a nice and straight neck all the way back. So for that, you need to kind of position yourself first and then bring the microscope into yourself, and then making sure that you have good position and work in this area. And that's where the ergonomics part of the whole situation comes in, where you're working in your little area, your assistant is in this little area, and then you're going back and forth, positioning yourself properly. This repetitive motion is going to cause a little bit of problems here for your elbow and your rotator cuff, because that is essentially a rotator cuff type of a motion. It's kind of hard to change that. Perhaps you can change the positioning of your carts and your instruments, and if you're going to rotate, make sure you swivel with your chair, so you're trying to maintain the same type of a posture. So swiveling with your chair and then having your patient's chair also be kind of loose so you can swivel the patient's chair also. These are all really important components in terms of positioning. Again, this isn't an exhaustive type of a review of positioning with the scope. If you guys are interested, let me know. I'll spend a little bit more time on specific teeth, the specific areas with positioning. But and also share your own tips and tricks. I'm by no means an ergonomic guru. There are many people who spend a lot more time talking about ergonomics, but ergonomics is very important for your long-term health of your body and your vertebrae and your skeleton and your overall enjoyment that you can get out of dentistry. If you're not careful, if you don't spend enough time and focus enough on maintaining proper posture while you're working, if you're one of these people who tends to kind of like do this and then you're maintaining this position for extended periods of time, what is happening is you're getting all the tension moving forward. You end up having not only a humped back problem with the neck, and then also your pectoral muscles and the whole area of your chest ends up just kind of getting contracted here. So what you need to do is, from this position that people tend to be in, make sure that between patients you're doing exercises that are expanding this kind of, neck back shoulders back and down, proper posture. That is basically the goal of having a healthy spine. So one of the things you can do, very simple, I'm going to teach you just a couple of things that you should do between patients, and also perhaps if you don't have that time, every few patients you should do. But before I get up, I want to also say another kinds of joints that are very important is to prevent carpal tunnel problems and so on. Make sure you constantly stretch your fingers between patients, your wrist, these types of exercises are all very important. You need to maintain flexibility. If you're not having enough flexibility, you increase your chances of injury and also muscle tension, because that static contraction is just a killer that we deal with on a daily basis while treating patients. Dentistry and endodontics is more like the surgical specialties in medicine. It's not like a physician, internal medicine, that is sitting around just kind of talking to people, occasionally just looking at something and doing a little bit of palpation, auscultation, and then writing scripts. We are the equivalent of the surgeons in the operating room doing long procedures of static contraction in the same place. So aside from those little exercises, let's take a quick look and see the couple of things that you can do on a normal basis between patients that will help improve your posture and also relieve some of the tension. So in order to improve your posture again, you don't need anything fancy. You don't need a whole gym or anything like that. In between patients, you just need a wall, a little corner or something like that. And the idea here is that you want to make sure you have this 3 points of contact in your butt, on your chest, the base of your neck area, and then the back of your head. And you want to go in there, make sure that your heels are touching the wall as well. So you have these points of contact, and then you're working your way up. And then what you want to do is you want to essentially with your hand push your neck in on the chin area, push this up like this. And what that does is it helps getting extension of your neck, and it's kind of rotating your skull anteriorly in this fashion, so that it's basically pulling through this occipital area on your spine, pulling it up like a little string, like a marionette kind of little string from above your head, pulling you up like this, pushing yourself back. Then you kind of push your chest back like this, expand yourself. You want to hold this position for 15 seconds if you can, up to 30 seconds if you will, but 15 seconds is enough. And then you let go a little bit, you loosen up, and then once again you do it another 15 seconds. Do this 3 times, and do it 3 times a day at least in your operatory. This will help improve again, moving from this position of contracted where you're moving forward to this position of opening up, and improves your breathing as well as improves your posture. It's very important when you're working. Don't get, especially when things start to go south and it's not looking good, or we have a schedule with 15 patients in the waiting room. Of course, you can't do that during COVID area. That's maybe one benefit of this whole thing, has been that you're seeing less patients and spending more time with patients. So you should stay more relaxed during your procedures. Don't get into this position, you're looking for a canal, you can't find a canal. Don't go, all that tension and contraction is horrible. What you want to do is you want to make sure that you always stay relaxed. Just like sports, right? I mean, we know at the highest level of performance when it comes to sports, all these athletes are relaxed. It's when they tense up is when they actually end up screwing up. When you're doing a 100-meter dash, whether it's in running or especially in swimming, your body is fairly relaxed, and that helps you to get the required elasticity that you get from your muscles. All right, just a couple of things that you could use in your office that are not going to take up a whole lot of room, and it's not like the equivalent of having a whole gym in your office in between patients. It's having something like a little resistance band. These resistance bands are really, really awesome, and they help you do the exercises that you need to do to improve your upper back health. These kinds of exercises, when you're pulling back, right, the equivalent of the IT and W exercises, that are things where you kind of bend down and you are doing the W's like this, and then the T's like this, and then the I's like this. This all helps strengthen you at the base of your neck to maintain your head and have also a nice cervical posture, the base of the neck and those muscles between the scapula. And every time you're doing this, you're essentially imagining that you're pulling together your scapula. Scapula is a very important kind of component of this whole thing. You're pulling this stuff together. And you could do this also with these resistance bands, where you're kind of holding and then pulling these back here a little bit, and that helps, and you can maintain. It doesn't have to be repetitive motion. You can do just static contraction of pulling and then holding, and this holding will help just strengthen that muscle too. There are all kinds of things you can do with something like this. You can, you can put a little knot on it. You can put it on a door, close it up, and then do downward motion. You can put it at the bottom of a door and do upwards pulling motion. All you need is really the resistance band. So one other little tool that you can have, well, it's not maybe so little because it actually will take up a lot of room, but it is important because your core is going to have to be as strong as possible. And something like this, which is just a little exercise ball, is going to be very helpful in between patients where you can work on your core. So let me just quickly show you what I do in the probably silliest kind of position you're going to see me in. I do this between patients, maybe not between every patient, but every few patients. And what it does help is this motion will help work on your core muscles that will help you maintain that proper posture during treatment. So let's take a quick look at this. So I've even seen people that sit on these things and in fact see patients on these. I'm not sure if I'm comfortable with that. I need to have that little bit of lower back support and then the elbow support that I get from these microsurgical chairs. But ultimately what you want to do, you roll over on these between patients, and the idea is that you're tightening this up, you're kind of keeping yourself straight, because remember, in most of the regular practice, what you're doing is you're leaning forward. Now this is using the other muscles in the front, and you can kind of hold this and you do these little crunches, this small little up and down motion in the form of a crunch. And I do these like in sets of 50, and it does just help. It's not really a big equivalent kind of crunch like that, but it does help to just strengthen your back. You can also from time to time do this extension. You got to be careful with the neck though, so you don't hyperextend the neck. But this type of rolling back is the equivalent of the cobra position in yoga when you're sitting on the ground. But here you're just gonna, this really helps you, and then you can let your arms go and relax and let your chest expand. And that is really a really helpful kind of opening up exercise. Remember, that's again another critical thing. So you can also use this for those T and W exercises that I told you, by putting your chest in and then having light weights or even no weights at the beginning, and just gonna do this. And what this does is it helps you kind of get good balance as well as get those base of the neck a little bit of strength. So exercises outside the office, such I play squash, for example, with some of the racket sports and things like that are very important. It helps with your stamina and your aerobic kind of capacity, which is important, but muscle strength is very important too. So to that extent, something like something as even as simple as Tai Chi and things like that are going to help improve your muscle strength as well as all the other things. One last thing, because we're seated all day long, things such as a compression socks will help also prevent varicosities and so on that are happen quite often in surgeons and in dentists and people that are in one position, seated or standing up all day long. All right, guys, so share with me your thoughts and your ideas on what you do that I'm not doing and I should be doing, because it's obviously important. It's all about sharing our ideas and our thoughts. I look forward to your comments below this video to see what you do, and also don't forget to share this video if you thought it was helpful. And until then, let's save some teeth, and also don't forget, we gotta always remain active. So in your practice and every time. Have a good one, guys.